The thing I was really looking forward to at ASH that I know will be different this year is interacting with other people in the CLL community, because that's one of the best things about the meeting is get to talk to people from other centers or other parts of the world to see what's interesting to them. So I have some virtual meetings, but it will be disappointing not to meet with other investigators in person. I think the most interesting, I don't know of anything that in CLL that's going to be like highly practice changing at this meeting. I'm looking forward to hopefully some follow-up on some of the larger studies. No, I'm really excited to see the results of the Umbralisib plus Ublituximab or U2 study. So that's comparing it to Obinutuzumab and Chlorambucil. And it's treatment naive and relapsed refractory CLL. So I've seen some reports of the efficacy and toxicity of this regimen before, but I'm just excited to see how it compares to Obinutuzumab and Chlorambucil and see all the data from that study. So I think I'm really looking forward to that. And then beyond that, I think there's just some hopefully nice updates on kind of studies with drugs I've heard of before. So there's an update on like the LOXO 305 drug. There's a study that's being presented, so I'm looking forward to seeing that. And then there's some Bruton and venetoclax studies that I'll have follow-up, and also the CLL14 trial will have some follow-up. So I think it's mostly going to be learning more about these really exciting regimens with additional follow-up, and then the Umbralisib Ublituximab, I am looking forward to hearing more about that. I think that's going to be really exciting.